What is the flu? Influenza, commonly known as the flu, is an acute infectious respiratory disease caused by the influenza virus. It is primarily transmitted through airborne droplets when an infected person coughs or sneezes. The illness typically spreads widely during the autumn and winter seasons. How does the illness begin? The flu usually has a sudden onset. A person may have felt perfectly healthy the day before, but within a few hours, the following symptoms can appear: a sudden high fever, body temperature can rise to 38-40 degrees C, or 100.4-104 degrees F, headache, especially in the forehead and around the eyes, joint and muscle pain, general malaise, and fatigue, sore throat, dry cough, nasal congestion or runny nose, nausea, loss of appetite, chills. Risks and complications of the flu. While the flu itself often subsides within 5 to 7 days, its complications can be severe, particularly for children, the elderly, and individuals with chronic underlying health conditions, e.g., heart, lung disease, diabetes. Potential complications include bronchitis and pneumonia, lung inflammation, middle ear infection, otitis media, inflammation of the heart muscle, myocarditis, inflammation of the brain membranes, meningitis, worsening of chronic conditions, e.g., asthma, diabetes. Treating the flu at home. Important: you must consult a doctor immediately if your fever exceeds 39 degrees C, 102.2 degrees F, persists for more than 3 days, or if you experience difficulty breathing or chest pain. Get plenty of rest. Help your body fight the virus by conserving energy. Avoid physical exertion and rest in bed. Drink plenty of fluids. Consume warm water, tea, lemon water, freshly squeezed fruit juices, or broth every 30-60 minutes. This helps reduce fever and flush out toxins. Manage the fever. Use fever-reducing medications like paracetamol, acetaminophen, or ibuprofen strictly according to the package instructions, and preferably after consulting a physician. Applying a cool, damp cloth to the forehead, armpits, and groin can also be beneficial. Care for your nose and throat. Gargle with warm salt water, 1/2 teaspoon of salt, in a glass of warm water. Use a saline solution, 0.9% NaCl, nasal spray or drops to moisturize and clear nasal passages. Inhaling steam, over a bowl of hot water, or with added medicinal herbs like chamomile, can help relieve nasal congestion. Eat appropriately. Opt for light, easily digestible meals such as warm broth or vegetable puree. If you have no appetite, do not force yourself to eat, but continue to maintain fluid intake. What to avoid during the flu? Do not self-medicate with antibiotics. The flu is a viral illness, and antibiotics are ineffective against viruses. They should only be taken if prescribed by a doctor for a bacterial complication. Avoid overheating or bundling up excessively. This can further raise your body temperature and place an unnecessary strain on your cardiovascular system. Completely refrain from smoking and alcoholic beverages. They can impede the recovery process and increase the risk of complications. Day 1. The body begins fighting the virus. Morning. Upon waking, drink a glass of warm water with lemon and a tablespoon of honey. If you have a fever, take paracetamol or ibuprofen. Have warm chicken or vegetable broth for breakfast. Rest throughout the day. Daytime, drink warm fluids, tea, broth, lemon water, compote, every hour. Continue gargling and using saline nasal spray 3-4 times a day. Ventilate the room. If the fever is high, apply a cool compress to your forehead and armpits. Evening, have a light dinner, vegetable puree or soup. Do steam inhalation with potato or eucalyptus, chamomile steam. Drink warm tea with honey and lemon and go to bed early to rest. Day 2. Symptoms begin to subside. Morning, drink a glass of warm water with lemon. For breakfast, have oatmeal or buckwheat porridge with a banana. Continue caring for your nose and throat. If the cough is bothersome, drink warm milk with honey in the evening. Daytime, maintain your fluid intake schedule. Rest, but you can move gently around the room. If the fever has subsided, incorporate vitamin C-rich foods, lemons, oranges, bell peppers, into your diet. If the headache persists, apply a cool compress to your forehead. Evening, eat a light meal. Repeat steam inhalation. Drink warm tea. Keep your feet warm and try to go to sleep earlier than usual. Day 3. The body starts recovering. Morning, even if you feel better, Continue to conserve your energy. Have warm porridge and tea for breakfast. Continue nasal and throat hygiene. Daytime. Do not forget to drink fluids. Perform light stretches or walk slowly around the room to improve blood circulation. Eat fruits rich in vitamins, kiwi, oranges. If the fever is completely gone, you can go outside for a short while, in a place sheltered from the wind. Evening. Consume a warm meal and tea. Ensure you get complete rest and pay attention to the quality and duration of your sleep. Additional recommendations: ventilate your room daily for at least 15 minutes. Do not use nasal decongestant sprays for more than 3 consecutive days to avoid rebound congestion. Maintain a diet rich in fruits and vegetables. Even after full recovery, avoid exposure to cold for another 2-3 days and gradually resume physical activity. Thank you.